What if I told you that up to 40% of breast cancers could be prevented through lifestyle changes alone? I am Dr. Jeff Mathe, and today I'm going to share the science-backed strategies that actually works to reduce your breast cancer risk. Stay with me because some of what you've been told about breast cancer self-exams might surprise you. Welcome back to Your Health with Dr. Jeff Mathe channel. It is October month, the Breast Cancer Awareness Month, and while pink ribbons are everywhere, but I want to go beyond that and talk about prevention. Because here's the truth. Breast cancer is one of the most common cancers affecting women worldwide, but it is not inevitable. It is not. There are proven evidence-based steps that you can take right now to lower your risk. So let's dive into what actually works. First up is maintaining a healthy weight. And I know everyone these days talks about weight, but here's why it matters specifically for breast cancer. Excess body fat, especially after menopause, it will increase your estrogen production. And estrogen production in your blood can fuel hormone receptor positive breast cancer. And studies have shown that women who maintain a healthy body mass index, which we call BMI, throughout their adult life, they will have significantly lower risk in the post-menopausal breast cancer. So that's number one. Number two is exercises. This is one of the most powerful tools that we have because the American Cancer Society recommend actually 150 to 300 minutes of moderate activity or 75 to 150 minutes of vigorous activity per week. But that could be brisk walking, swimming, cycling, dancing, but definitely is whatever gets you moving. Don't sit too much. Exercise will help regulate your hormone, reduce inflammation, and help maintain that healthy weight we just talked about. Number three, limit alcohol. Here's one that surprised people. Alcohol, yes. Even moderate drinking increases the risk of breast cancer. The relationship is dose dependent, meaning every additional drink that you use per day, it will increase your risks by 7 to 10%. You hear that? If you choose to drink, limit at least to one drink per day, not more. And I know that what you want to hear is not that because of your happy time, but know that if you drink more, your risk will go up to 7 to 10%. Know that. Other factor is breastfeeding. If you have children, breastfeeding offers a real protection. The longer you breastfeed, the greater the benefit. That's why you say at least 6 months, but you can go beyond. This is because the hormone changes during lactation and the way breast tissue are shed during weaning, they will help remove cells that are damaged in your breast. And those are lifestyle action. The lifestyle action. Did you get it? We say 1, maintain healthy weight. 2, stay physically active. 3, limit alcohol. And 4, breastfeeding. Yes. But now, for women at higher risk, there are medication that can help. I'm talking here about what we call SERMs, or selective, they call them selective estrogen receptor modulators. And here we have the like of tamoxifen, you've heard about it. They can reduce the risk of estrogen receptor positive breast by 50% in those that are high risk. Only those patients. There are also what we call aromatase inhibitors, and also they work better in those that have already passed the menopause. But here is the thing, these medications come with side effects. So you take them, you have side effects. That's why they are typically recommended only for those that are increased risk of breast cancer. So this is something that you need to discuss with your doctor if you want to take them. So let's talk about hormone replacement therapy and birth control pills, because this is something that is always in the news. But know that combined estrogen, progestin, hormone HRT, or hormone replacement therapy does increase your breast cancer risk, but only if you're using it for long term. So if you want to use it, go and discuss with your provider and use the lowest effective dose for short time possible. What about birth control pills? It also increases your risk, but slightly, but it depends on the duration. Again, you know that oral contraceptive pills have other health benefits, so this should be an individual decision to make with your doctor whether we use it or not. If they are there to heal some other disease, then you have to take it. Discuss with your doctor. Now, I'm going to surprise you with something now. So let's talk about what we call breast self-exam. That is the surprise, because for years we were told to do monthly breast self-exam, isn't it? But here is what research shows actually now, because large randomized trials have found that systematic monthly self-exam did not reduce breast cancer. No, it didn't reduce. In fact, they led to more doing biopsies, and also it increased anxiety in those women who were doing that. That's why some organizations like American Cancer Society, they are no longer recommending this routine monthly structured self-exam as a screening tool. No, it's no longer recommended. But wait a minute, does it mean that I will ignore my breast? Absolutely not. You are not going to ignore it, but we recommend what we now call breast self-awareness. Breast self-awareness. That means that being familiar with your breasts, how it looks, how it feels, and reporting any changes that you find to your doctor. So you need to know what is normal to you and watch the warning sign, which can be a new lumps, a swelling on the part of the breast, the skin dimpling on puckering, nip retraction. That's when it's taking in, it's going inside. Redness, thickening, any nipple discharge other than the breast milk, or swollen lymph nodes under your arm or near your clavicle. Those ones, they are signs that you need to go and report it. Now, if you still want to do regular self-check, please, for your peace of mind, do it. But you need to do it right. This is how we do it. First, timing. The best time of doing it is 3 to 4 days after you started your period. If you are postmenopausal, pick a same day. If it's the 1st of the month, if it's the 10th of the month, you pick the same day. So you start with visual inspection. You stand in front of a mirror, your arms on your side, then you see overhead, then you on your heel, and look for any changes that you see on your breast. Sorry. Then you pass to manual exam. For this one, you need to lie down. It spread your breast evenly so that you can see any changes, and use your 3 fingers to palpate systematically, either circularly in circle manner or vertically like this strip. Okay, check from your collarbone to the bra, or you can go from middle to outside if you are doing a circular. So what you are looking for is something different what you normally feel. The lumps that are cancerous, they will tend to be hard, irregular in shape, and fixed. You cannot move them, and they are usually painless. No pain in those cancerous lumps. But remember, most lumps are not cancer. You need to know that. So if you caught something early, they heal better than if it's too late. What about genetic and screening? Mammography remains our gold standard for early detection. Generally, we recommend mammography to be done annually or biannually at between 40 and 50, depending on your risk. Those of high risk women will need to do early or frequent mammography. Genetically, if you have what we call BRCA1, BRCA2, or breast cancer gene 1 and 2 mutation, your life risk of getting cancer is increased by 70%. In these cases, what you need to do is chemo prevention. You need to dose medication that we talked to you earlier, and by doing so, it can reduce by 90% your risk of breast cancer. What about diet? Quick word on diet. While eating healthy diet rich in fruit, vegetable, and whole grain is great for overall health, we don't have definitive proof that specific food prevent cancer. They say, did you see this and it prevent cancer? No. But the Mediterranean foods, it's showing some good result, but there's no yet conclusion. We still need more research. Here is the bottom line. Breast cancer prevention isn't about one magic solution. It is about understanding your personal risk and then making informed decision about the factor that you can control. The factor that you can control, not the other one. The strongest evidence supports that 1, you maintain a healthy weight. 2, you exercise regularly. 3, you limit your alcohol intake. 4, be aware of your breasts and report any changes. And 5, for high-risk women, then we might consider chemo prevention. Take medication. This is October. Let's go beyond awareness, but let's take action. Let's take action. If you found this helpful, give a thumb up and subscribe to Your Health with Dr. Mathe for more evidence-based health information. And drop a comment below. For example, I can ask you a question. What is one change that you are going to make today for your breast health? What is it? Write down. I read all the comments. And share this video with your woman of life, with your mother, your sister, your daughter, your friend. Share it. Knowledge is power, and prevention starts with information. You've just got this information. Links to all scientific references are in the description below. Until next time, this is Dr. Jeff Mathe, reminding you that your health is in your hands. God bless you.